Defining sudden infant death syndrome, it's basically the death of the infant in the infancy period. And while we are defining the infancy period, it's basically under 1 year of age. So it's quite a simple definition. And whenever the death occur in the infancy period, it is investigated in detail by the forensic practitioners or by the investigating officers, by the legal authorities. But in cases of SIDS or in cases of SUDS, crib deaths or cot deaths, they're also commonly known as crib deaths or cot deaths. In such cases, whenever the autopsy is done, it's a negative autopsy. And whenever the complete crime scene investigation is done, it's almost negative in a lot of cases. Sometimes the mother or the father will give you a history that the infant had been suffering from gastroenteritis, or he or she had been suffering from a respiratory infection. But still, these are just the justification causes that are given by the parents that are already in a very debilitating and in a very grieved state. So even ethically, you should empathize with such parents, and you should counsel them in detail. So while we are discussing these cot deaths and these crib deaths, the medico-legal aspects should be kept in mind. Now, talking about the medico-legal aspects in such cot deaths or crib deaths, now we have the causes like it can be accidental in a lot of cases, and then it can be homicidal. If signs of foul play are seen, then we can consider it to be homicidal. And obviously suicidal intentions are not there because it's an infant that we are talking about. So the causes are usually accidental or they are homicidal. So if there are any signs of foul play, you should emphasize on these factors in detail. And obviously the environment is very important. Then we have a syndrome which is known as a battered baby syndrome. So if there are any signs of abuse, or if there are any signs of violation, violence are seen on the baby, they have to be noted down in detail, especially, but you don't have to confuse them with the signs of resuscitation. They are basically the discoid signs that are seen on the chest due to the chest compressions. So you don't have to confuse these signs of resuscitation with the signs of violence. There is again a very thin line between them. So it can be quite confusing for the investigating officers or whosoever is performing the autopsy report in such cases. In this section, we'll be discussing how do we differentiate the SIDS from the external suffocations. And this is very important to basically differentiate this SIDS phenomena from the external suffocations. The accidental deaths are usually due to the suffocation of the child. So the preventive factors that are usually discussed are regarding this external suffocations that are usually have found to be there whenever we are suspecting SIDS in a lot of cases. So moreover, we'll be discussing the multiple sudden infant deaths in these cases, and why is this number rising day by day? What is the cause behind it? That will be discussed over here. And then the counseling of the parents. So as an ethical duty of any doctor, whenever any death occurs, it's the ethical duty of a doctor to basically break this news to the relatives. And over here we are talking about a pair of grieved parents, that is the mother, the father. The relatives are quite grieved and in a state of shock. So how are you going to basically counsel such parents in such a case? And it's very important that you do that if you are the person who performed the autopsy on their baby. So you're going to basically break the news to the parents that this was the SIDS syndrome, and you're going to counsel and you're going to give information regarding the SIDS, that is the sudden infant death syndrome, because educating the parents is very important whenever we are considering such a situation. Now, talking about the medico-legal problems in the cot deaths. Now, whenever we are differentiating the cot deaths from the external suffocations, it's again very important that we see signs for the external suffocation. We see signs, we look for the signs of any foul play if it is there. We are basically differentiating between an accidental SIDS, and we are differentiating from any foul play if it has been there. So a foul play, obviously it can be through any poisonous substances, any mechanical trauma, or the shaken baby syndrome can be there, or the signs of violence has to be looked for. All of these has to be quite clear. We have to send these samples to the chemical pathologist. We have to get the MRIs, the CT scans done for any fractures or any signs of the shaken baby syndrome. They are going to be there whenever we are investigating such deaths in these sudden infant death syndrome, in these cot deaths, in these crib deaths. We are basically we have to counsel the parents at the end. So working as a medico-legal officer, one should be quite sure that this was SIDS and not a homicide, or it was not of any foul play origin. Now, differentiating SIDS from the external suffocation, the signs of the infant suffocation, they're not present in cases of SIDS. In cases of the external suffocation, you will see signs of smothering, you will see signs of overlaying, and obviously the bluish discoloration and the signs of the suffocation are going to be there. And then you will be able to see any bluish discoloration, as well as the engorgement of the neck veins, engorgement of the veins in the scalp. They are going to be there if there were any signs of the external suffocation as well. Now, the signs of the SIDS are also nil. So basically, we are at an equal level because SIDS doesn't have signs, and so this is going to point out towards SIDS. Intrathoracic petechia are going to be found at the thymic cortex in the SIDS. So SIDS is one of the causes of the sudden unexpected infant deaths. Then the sudden unexpected infant deaths, also abbreviated as SUID, have a cause, that is the accidental suffocation. Then unknown causes are there that basically don't have any etiology. And then we have infections, inborn errors of the metabolisms can be there, cardiac channelopathies. They are basically the cardiac channelopathies are basically, we are referring to the valve disorders, and they are basically the birth defects. They can be present over there. We have Reye syndrome, for example, that is basically the kidneys and the livers are affected in the Reye syndrome. So all of these are the causes in such a case. Then if the foul play is there, we can have poisoning cases, and we can have also cases of the overdosages in such cases. The possibility of foul play is basically rising the number of the multiple sudden infant deaths in such cases. There are familial, metabolic, and genetic diseases in a lot of cases. Then we have mechanical suffocation in these cases. And basically, the other demonstrable causes of death are not found over here in such a case. The counseling of the parents is again very important. We have to give knowledge to the parents that this is basically the critical developmental period, that is 0 to 12 postnatal months. This is basically the critical developmental period, and SIDS occur due to that. Then there are extrinsic risk factors, for example, the non-supine sleep position, soft bedding, and overheating. So these can be the exogenous stressors, and then we have the vulnerable infants on the other hand. That is, the intrinsic risk factors can be the genetic predisposition, and then the risks during the development. So these can be the causes to this. This is an ethical duty as a medico-legal officer. Anyone who has performed the autopsy on such a infant, it is the intense desire to know why the baby died. The parents are quite eager to know why their baby died. So one has to be quite clear at oneself, at their own level, what were the causes of death, and then you have to educate the parents as well about this condition. That is the end to this section. Thank you for watching sqadia.com.